It's a pleasure to have this discussion this afternoon on monkeypox or MPX. This evening, we will use monkeypox and MPX interchangeably. There are other acronyms like communicable disease and epidemiology, CD&E, we will use, but there will be recurrent themes that you will hear all the speakers share tonight. We want to impart and share as much information as we can this evening. Our public health response began as early in May, once the first cases of MPX were identified in the United States. In May, the cases were reported in the UK, and then on May 18th, we had cases reported in Massachusetts. And so our team began to put together a plan with increased transmissions growing in the US and internationally. Our Department of Health and Human Services Public Health Service team began to develop a response and timeline for a vaccine strategy back in May. And I want to just share with you some of the timeline and how we continue to evolve and evaluate our vaccine plan, similar to some of the strategies that we deployed using during COVID, using access frameworks to make sure that we know demand is a challenge, but we want to equitably administer vaccines as soon as we get them in. We want to get those doses in the community. So the implementation of our MPX response plans continue to evolve based on federal and state guidance, including vaccine and test kits that become available to county health officials. On May 19th, we began working with our state and regional partners to understand clinical guidance and how access to vaccines would be administered, again, equitably. In May and June, our clinical and program teams participated in many ongoing federal and state level discussions with the CDC, with Johns Hopkins, with the Maryland Department of Health regarding case analysis and contact tracing. In mid-July, we issued a public health advisory, and our communicable disease and epidemiology, CD&E team, and our sexual health team created an initial screening tool for at-risk communities defined by the Centers for Disease Control and Prevention, the Maryland Department of Health, and case investigations. Our clinical teams, Dr. Rosen and Ms. Townsend, will share some of those strategies that we either developed or those best practices that our research and evaluation team continues to explore. On July 20th, we issued a press release regarding the challenges associated with a limited number of MPX vaccine and doses. So let's think about those doses. And, Council Vice President Glass talked about the District of Columbia being a state entity. Well, our first allotment of MPX vaccine was 50 doses solely for post-exposure prophylaxis of close contacts or those known exposures in the county through our healthcare providers who didn't have vaccines available yet. Then we received another 200 doses specifically identified for larger counties, Baltimore City, Prince George's, and Montgomery County. And then we received another dose of another tranche of 600 doses almost a week thereafter. We continue to advocate for more doses because we know, based on our pre-selection, our pre-survey tool, we had over 2,000 respondents and we had about 850 doses to work with. Just last week, we recently asked for an additional 2,000 doses. Now, we haven't received confirmation of how many doses we will get, but we will continue to plan for our vaccine strategy so that we can get those doses in the community. Our teams have created an MPX helpline in CD&E where citizens can call our disease control team at 240-777-1555 for information on vaccine eligibility, transmission rates, and how to reduce risk for MPX exposure. And then we have another number, 240-777-2982 for assistance with completing our MPX vaccine pre-registration form. And thank you to all our residents who have completed the vaccine pre-registration form, and we have additional information regarding notification and a website that Ms. Townsend will talk about later during our town hall discussion. We continue to stay in touch with our federal delegation, as Council Vice President Glass indicated. We've even had a conversation with Congressman Raskin's office where we've explicitly asked for help and urged again for more vaccines. We need more vaccine. Demand is an issue and a challenge, and we want to be very frank and open about our request for demand and how we will use our vaccines in the community. We're also managing our surveillance and transmission and outbreaks. However, our public health team is developing a data dashboard. We've had requests for a data dashboard. The Maryland Department of Health is also crafting a data dashboard based on surveillance data, but we want to look at our county level data, similarly as we did with COVID, as data are available to identify case demographics, the number of vaccines administered, current risk profiles, and local positive case transmission data. So we hope to have that up and on our MPX website at the county's portal sometime next week. Now, we are trying to work on that, and we have to test it to make sure that we can launch the information, that we have all the data feeds. So we're working on it simultaneously along with the Maryland Department of Health. We also plan to follow federal guidelines and deploy a dose-sparing vaccine strategy. I'm sure Dr. Rosen is going to share some of that with you this evening within the next week to increase community access. We understand that there is a demand and we want to increase our community access. As Dr. Kroll and Council Vice President Glass indicated, anyone can get monkeypox. I'll just say that again. Anyone can get monkeypox, which makes it a health concern for all. And we know it's been frustrating for the public, and we want to recognize the need to have more community engagement, as Dr. Johnson indicated, in the form of a town hall or information sessions via other media platforms. But I also want to urge everyone to also practice harm reduction strategies to help us reduce the spread of MPX in the community. Now, how can you do that, you may ask? Well, avoid coming into contact with people recently diagnosed with MPX or those who may have been infected. Avoid sharing bedding, toys, and eating utensils, just to name a few. Wash your hands, which is a proven public health preventative measure. Wash your hands with soap and water or use hand sanitizers, especially after coming into contact with those who may have been infected or suspected infected. Limit close skin-to-skin contact for long periods as defined by the CDC. Now, what does that mean? According to the CDC, prolonged periods of close skin-to-skin contact includes 3+ consecutive hours of contact. Be mindful of festivals, events, concerts where attendants are fully clothed and are likely to share skin-to-skin contact. These are safer activities. However, again, folks should be mindful of activities that involve kissing that might spread MPX. Avoid parties, clubs, saunas, back rooms, and spaces where there's anonymous contact, where there's minimal clothing, and where there's direct personal and often skin-to-skin contacts at higher risk. And Ms. Johnson and our team will continue to share these harm reduction strategies, but these are just a few. Always practice hand hygiene. That's a recurring message, a repeated message. And lastly, use personal protective equipment when caring for patients with confirmed or suspected MPX infection. Wear a face mask if you're in close contact with someone who has symptoms. We continue to work closely with the Maryland Department of Health, advocating again, which is one of our most recurrent and strongest message to our decision makers. We advocate for our fair share of vaccines and partnering to get more vaccines in our community. It is as simple as that. There's always a public health challenge with what we cannot and can do to vaccinate more residents and suppress the spread of the virus. So this is what we currently cannot do. We cannot get as many doses as the Washington, D.C. Department of Health, as Council Vice President Glass stated. D.C. receives their allotment based on state level consideration, and therefore they're able to get more vaccines, but we will continue to push for more vaccines in our community. We want nothing more than to vaccinate all who are at risk or who would like to get vaccinated for MPX, but currently cannot due to such a high demand. Our healthcare facilities or other healthcare facilities or federally qualified health centers may also have access to MPX. And we're working with them to make sure that they have the education, that they have the resources that we have access to, and that we continue to partner with information sharing and dissemination. But again, we cannot access federal pipelines to get more vaccines. Now, I talked about what we cannot do, but this is what we can do and what we have been doing. We can provide updated information regarding how important vaccines are as the most effective tool in preventing the spread of monkeypox. We can make it a habit of exchanging MPX vaccination and testing best practices with community partners, healthcare providers, affected individuals, and county officials to ensure people who need care can access it and know how to protect their loved ones. We can continue to participate in discussions like this, and we will continue to participate in county level discussions with various agencies. Just to name a few, our congregate living spaces, our correctional facilities, our homeless shelters, our nursing homes, our assisted living facilities, our Montgomery County public school system, our early child care learning centers, and our Montgomery Care Safety Net clinics and hospital partners. And we will continue to have interjurisdictional conversations with DC and Virginia via the Metropolitan Washington Council on Governments to identify strategies to increase equitable access to vaccines. And you can help us craft targeted messages. We want you to be engaged as you've been engaged before, similarly to COVID, and help us provide increased awareness and knowledge in our community, to reduce the chances of stigmatizing those who may have been in contact with the virus or marginalizing groups who may be assumed to be at increased risk for monkeypox. And we know that we cannot suppress the spread and mitigate further community level transmission without you. Simply put, thank you for keeping us informed as our community pulse. Lastly, we'll continue to keep the lines of communication open with our liaisons, like Dr. Johnson, and partners with updates on the status of our vaccine supply and how they can be accessed. We will continue to raise awareness, and we will continue to share up-to-date information about what or how people can protect themselves and others from the spread of MPX.